My baby has a tongue tie. Now what? What should we expect when we're going in to have that revised or clipped? I want you first to know that having a tongue tie clipped or revised doesn't necessarily mean that it is a magic fix to your breastfeeding or feeding issues. It's often the first step in order to have your breastfeeding journey go back to a more pleasant experience. So while about 80% of mothers report an almost immediate decrease in their pain level, baby still has been using that tongue and compensating for a long time. That tissue has been under the tongue since 8 weeks gestation, so there is some unlearning and relearning that is going to need to happen in order for baby to feed more efficiently. Oftentimes, body work, some training exercises, and continued lactation support are what will be needed to help get you back on track. But what should you actually practically expect after that tongue tie revision? So usually day 1 to 3, baby may be fussier than normal. They've just had an oral surgery, and so they're going to feel a little uncomfortable. You may start to see a white patch form, and there should be a diamond-like shape under the tongue. We want that diamond shape to heal this way and not this way. So you'll have your provider tell you to do some stretches to keep that tongue from reattaching. Our bodies like to heal together, so if you cut yourself, your wound will heal together. So again, we want that wound under the tongue to heal this way, so that the tongue can move instead of this way, reducing what you've just done for your surgery. So they'll have you do some stretches several times a day to keep that tongue from reattaching. You may also notice that your baby has a harder time than normal latching to breast or bottle. So make sure you have an alternative feeding plan handy just in case your baby's struggling for the first 1, 2, or 3 days. This can include cup feeding, syringe feeding, or finger feeding. Again, if you're having troubles latching or your baby isn't able to feed efficiently, please make sure you reach out for lactation support as soon as possible. By day 2, 2, 3, 4, up until the first week, pain management might be needed to help your baby feel more comfortable. This can be from a variety of ways. If you have a younger baby, the best remedy that I recommend is frozen breast milk. Take about an ounce or 2 of pumped milk, put it in a freezer bag, lay it flat so that it makes a nice flat strip, and you can break off little pieces of that frozen breast milk to put under their tongue or let them kind of suck or lick on it, because frozen breast milk is a natural pain reliever. It's also safe for a baby at any age from newborn right on up. There are natural remedies like arnica or camellia, or there's also infant Tylenol. Make sure that you're asking your provider and your pediatrician for the best way to do pain management for your baby, as anything like Tylenol is recommended by age and weight. Now, usually day 3, 4, 5 is the hardest. The first day or 2, that wound is pretty open and fresh, but day 3, 4, 5, that white patch is forming under the tongue. And it would be, I can imagine, just like with us when we have a cut or a bruise, when you have that tissue starting to heal, it can probably feel a little itchy or tight. So most parents will say day 1 or 2 were pretty great, day 3, 4, 5 were pretty difficult, but by the end of the first week, as the tongue is healing better, parents will notice a bigger significant difference. From week 2 to 4, healing will look different for every baby. All of our bodies heal differently. Some bodies are super healers, heal pretty quickly, and by the end of the first week or 2, you may feel like most of your symptoms have resolved. For some babies, it may take 2, 3, 4, 5, 6 weeks to really get back on track, depending on what else is going on in the body. But usually by the 3rd or 4th week, that healing should be pretty complete. You'll see that diamond under the tongue shrink and continue to shrink significantly more. And you should see a pretty good reduction of your symptoms at that point in time. You may still need some body work depending on what your baby is experiencing in terms of tension. Suck training exercises should be ongoing, and lactation support can really help you get back on track. Now, what is body work? Body work is any time that a professional is physically touching your baby in order to bring change to their body. Body work can include occupational or physical therapy, chiropractic or cranial sacral therapy, or myofunctional therapy. These are all done by different trained professionals, and you'll want to make sure that you're using somebody who's trained specifically in infants and are really good at what they do. That's what to expect. Now you know.